or not. Mr. President, I rise now to address the Republican plan to have a vote on a health care bill, proceeding to a health care bill tomorrow. The only challenge is that we have no idea what bill we're being asked to proceed to. This is hardly the way a democratic republic operates, in which the leader of the majority says, we want to come to the floor with no committee deliberation, no consultation with healthcare experts, no dialogue with the public, no amendments in committee of any kind, and vote on a mystery bill. The biggest mystery to me is how it is possible that the majority Republicans are taking seriously a plan to rip health care from 20 million plus Americans in order to give fabulous giveaways to the richest among us. The bill that they entertained previously would have given $33 billion to the richest 400 Americans. $33 billion. Now, and I've mentioned this number before. Some journalists have said, quoted it as 33 million, and some citizens have said, you mean 33,000? No, $33 billion to the richest 400 Americans. Enough funds to pay for Medicaid for 700,000 people. What individual would say it's moral to rip health care away from 20 million people to give tax breaks to the very richest among us? Well, on some misguided, mysterious way, something has gotten hold of the hearts and minds of my colleagues and made them think this was some kind of good idea to do so much damage to so many. In fact, we've been having this conversation since January. It was earlier this year when President Trump was sworn in that the majority said, we're going to come to the floor of the Senate and we're going to repeal health care for millions of Americans in short order. Well, we're 6 months later. It hasn't happened yet, in part because when people look at the details, they start to raise questions. And it took a long time for the House to send a bill over to the Senate. And then the Senate proceeded to work on this bill with a group of 13 secret senators working in a secret room, in secret meetings, public not allowed, fellow senators not allowed. And they came up with a bill that looks very much like the House bill. We'll talk more about that later. The president said in his campaign and throughout much of this year, you're going to have such great health care at a tiny fraction of the cost, and it's going to be so easy. Well, it hasn't been that easy. We've seen the president back a plan from the House, and he invited everyone over to celebrate at the White House and get the champagne bottles out and say how wonderful it was that the House had passed this health care bill, this bill that would strip health care from more than 20 million Americans. Then a couple of weeks later, someone explained to him what was in that bill. And he said, oh, well, that bill is mean and heartless. And then the secret 13 here in the Senate meet, and they come out with a very similar bill. And now he's all excited. Trump's all excited. Now we have a really good bill, except that in a single year, it would do even more damage to health care in America. Along the way, the president moderated his dialogue a bit, and he said, who knew health care could be so complicated? Well, Mr. President, most of the people in America realize we have a complicated healthcare system. We have overlapping system of 6 different systems of healthcare. It really is quite messy and difficult. And it'd be great if we could, in fact, adopt a much simpler system. And I certainly have been advocating for us to have a much simpler system. So just by right of being an American, you're born into this world and you have health care. That's the way Most developed nations do it, but not here in the United States of America. We have a great healthcare system for the very wealthy, and we have a very complicated, stressful system for everyone else. What are we going to vote on tomorrow? I wish the majority leader would come to the floor and tell us. A motion to proceed to a bill that looks like what? What can you tell us? Is it Trump Care 3.0? How does it differ from Trump Care 3.0 or 1.0 or 2.0? Will it have the Cruz Amendment in it for fake insurance? The provision that would do enormous damage at both ends of the insurance market, providing fake insurance policies to the young and the healthy, and destabilizing health care and putting it into a death spiral for everyone else. Or, Mr. Majority Leader, maybe you could come and tell us if you're planning a straight repeal of the ACA, a straight repeal that would raise costs and premiums even higher, and not just rip health care from 20+ million people, but from 30 million plus people. A plan that would be even more devastating than the previous plan. Is that what you want us to vote on to proceed to tomorrow? I can tell you we shouldn't be voting to proceed to any version on health care, something that so affects the peace of mind and the quality of life of Americans. We should be operating like a democracy, like a democratic republic, holding committee hearings, holding a conversation. This is what we did when we talked about the ACA those several years ago. We had more than 100 committee meetings, roundtables, and walkthroughs here in the U.S. Senate. We had the single longest markup of a health care bill in the Health Committee ever in the history of the United States. We had the second longest session marking up the bill in the Finance Committee. We had entertainment of hundreds and hundreds of amendments, adopted over 100 Republican amendments. There was a very public, extended process with a ton of time to go home and consult with your healthcare experts and stakeholders in your own state, and with the most important stakeholders, the citizens of the United States of America, the men and women and sons and daughters and grandparents, and how did they feel about these changes? Well, as everyone knows, President Trump did call the House bill mean and heartless, but we just keep getting bills that are meaner and more heartless. Where the House bill would kick 23 million people off insurance in the next decade and 14 million just next year. The subsequent bills don't look that different. The Secret 13 here in the Senate went and did their deliberations, adopted pretty much the same thing as the Senate, only they made it worse. That June Senate bill would kick 15 million off in a single year rather than 14 million. And then we had the brilliant idea of a repeal-only bill, which would do even worse, kicking 17 million people off in a single year and 32 million off within the 10-year period. And then we have the bill that isn't even on here because we didn't get a Congressional Budget Office score on it. That is the special Cruz fake insurance amendment bill. The one that would say, hey, insurance companies, you can offer policies that are not worth the paper they're written on. Oh, they're very appealing. Here's a health insurance policy. You only have to pay $40 a month. Isn't that great? And then the policyholder who has it, they get in a car accident. They get a broken bone. They find out the emergency room is not covered. The x-ray is not covered. The cast is not covered. The doctor is not covered. Nothing is covered. That's why it's fake insurance. That's why it only costs $40 a month. It might as well be 40 cents a month for all we care, because it just doesn't cover anything. And then your spouse, your wife, has the great joyful news that you're going to have a child together, and guess what? Maternity care is not covered. Can you Imagine in this modern era not covering maternity care. And yet, before the Affordable Care Act, many, many policies in America didn't cover maternity care. Well, in addition, these brilliant plans by my colleagues would cause premiums to skyrocket. Then we have, of course, the fact that they do diabolical things to those who have pre-existing conditions. Now, let me spend a little more time on the special cruise fake insurance version of this. Yes, it gave those very cheap policies that aren't worth the paper they're printed on to the young and the healthy, but then those who are older, those who are sick or have injuries or have pre-existing conditions or are concerned that they may develop difficult medical issues, they need to buy a policy that actually covers the things that you would expect. That is, has an essential benefits package, the same as every single policy in America today has. But because the young and the healthy are buying the fake policies, that means that the cost skyrockets on the policies with the essential care benefits. And as a result of that, more people bail out who feel like they're not directly in danger of getting sicker or injured. And so then the cost of the policy goes up even more. It is a death spiral for insurance. Fake insurance at one end, destruction of the insurance market at the other end. So my colleagues decided not even to share the Congressional Budget Office analysis of that bill. It was that bad. Let's see what some folks said about this. Larry Levitt, the senior vice president of the Kaiser Family Foundation, said, and I quote, "If there were a joy of cooking for insurance, this would be the perfect recipe for destabilizing the market and turning the marketplaces into high-risk pools." That's his comment about the cruise fake insurance plan. And let's turn to a joint letter from Blue Cross Blue Shield and from America's Health Insurance Plans about the cruise insurance plan, the cruise fake insurance plan. And I quote, their letter says, "It is simply unworkable in any form and would undermine protections for those with pre-existing medical conditions, increase premiums, and lead to widespread terminations of coverage for people currently enrolled in the individual market." Or how about an article in The Atlantic by Van Newkirk, published just a week ago, July 14th of this year. Quote, "The Cruz Amendment creates almost a textbook scenario of wide-scale adverse selection, whereby riskier and more expensive patients wind up concentrated in risk pools and entirely undermines any tools for managing that adverse selection." That's a fancy way of talking about the death spiral in insurance for those who are not young and healthy. So then we go to the conversation that CBO says is the worst option of all. 17 million would lose coverage in the first year and 32 million by 2026 under the repeal-only plan. And next year, in just 1 year, premiums would skyrocket above what they might have gone to anyway by an additional 25%. Now, our majority leader likes to say that wouldn't actually happen because the provisions of the bill don't go into effect for 2 years. Well, these estimates and these commentaries take that into account because the destabilization of the marketplace begins immediately. Does anyone really think insurance companies are going to stick around in a marketplace that they don't know is going to exist in 1 or 2 years? This repeal and run strategy would throw our healthcare industry into chaos. If you think it's a good plan, well, I've got some beachfront property in Arizona you might want to buy. Every version of this Republican Trump care plan is worse and worse for the American people. Yet these are the options that are being put forward. The Majority Leader wants us to vote to proceed to this set of undesirables tomorrow. These undesirable, in fact, undesirable is just too kind a word for these policies. These are despicable. These are destructive. These are, as the President said, mean and hard-hearted. Shouldn't we try to pursue options that will make our healthcare system work better? That's what we need to do. And let's start by nailing down the cost-sharing reduction payments, or CSRs. These payments are a lifeline to more than 12 million low-income Americans. They lower the premiums and they lower the deductibles. They're an important source of stability for insurance companies. But our president has said, I'm not sure I want to release these CSR payments. So what happens with that? Insurance companies have to assume they're not going to get them. So they're raising their rates or perhaps bailing out of the market completely. If these CSR payments are terminated, insurers may leave these exchanges altogether. And for those who do stay in, the average premiums for silver plans would need to increase by 19% just to compensate for the loss of the CSRs. Because insurance companies are like any other business, they need to know how much they're going to be paid if they provide a product. And right now, they don't know. Let's hear what some have had to say. When the insurance company named Anthem pulled out of Ohio in June last month, the company cited, quote, continual changes in federal operations, rules, and guidance as the main reason for exiting the marketplace. The company also said, and I quote, the individual market remains volatile and the lack of certainty of funding for cost-sharing reductions does not provide a sustainable path forward. Then there's Brad Wilson, the president of Blue Cross Blue Shield of North Carolina, who said, the biggest single reason for that rate increase is the lack of federal funding for cost-sharing reduction payments in 2018. We cannot assume, nor should we, that the money is going to be there based on what we know today. At another point, Mr. Wilson was quoted as saying, the failure of the administration and the House to bring certainty and clarity by funding CSRs has caused our company to file a 22.9% premium increase rather than one that is materially lower. The rate increase would be 8.8% if the CSRs were guaranteed for 2018. A single-digit increase versus a more than 20% increase. And they have to go with the higher increase because they don't know if the president's going to make the payments that he's obliged to make. But I think a piece in the Baltimore Sun from May 5th describes the situation we find ourselves in best when it says, quote, it's not the problems in the Affordable Care Act exchanges that are driving the Republican effort to repeal Obamacare. It's the Republican effort to kill Obamacare that's causing the problem in the exchanges. It goes on to say the Affordable Care Act was carefully designed to mitigate those risks. President Trump and the congressional Republicans are trying to exacerbate them, and he closes by saying, no wonder rates are going up. No, this really does make clear the situation. The president wants to say the exchanges have problems, so we need to repeal and run or repeal and replace. Our answer to the exchanges having problems is to drive 20 million people plus off health care, maybe 30 million people off health care. But in fact, the exchanges are having problems because they're being sabotaged by President Trump and our Republican colleagues. First, by wiping out the reinsurance proposal, which enables companies to go into a new area and compete, but only if they have insurance against getting a disproportionate share of the really sick people. That's a very logical part of an insurance plan that encourages companies to go into new markets to compete, and my colleagues sabotaged it. The cost-sharing reduction payments that we just talked about, a very key part of lowering premiums and making the policies affordable so that struggling, hardworking Americans can buy those policies and have lower premiums and lower deductibles. But my colleagues and President Trump have sabotaged it. That is not a service to the American people. Maybe they feel they're doing a service to whom? To the rich who can buy insurance without any of this effort to provide insurance throughout our society? Do my colleagues really want a world in which we only have wealth care? That is health care that only the wealthy can buy? Do they really want to denigrate, tear down, and destroy the quality of life of millions of their constituents by pursuing this path? It's not that long ago that Franklin Roosevelt said the test of our progress is not whether we add more to the abundance of those who have much, but whether we do enough for those who have little. But in their bills, my colleagues have been saying, we want to give massive tax giveaways to those who have the most by ripping health care away from those who are struggling, hardworking Americans. It's the opposite. It's the opposite of the belief that we're all in this together and we want a foundation for every family to thrive. I want a foundation for every family to thrive, and that means peace of mind that if your loved one gets sick, that they will get the care that they need. It's a peace of mind that if your loved one gets sick, they won't end up bankrupt. So we're not just talking about ripping health care insurance away from more than 20 million people. We're talking about ripping peace of mind away from 20 million people. And we're not just talking about those individuals, we're talking about undermining the rural and urban health care infrastructure that helps everyone. I've been out in very rural Republican parts of my state holding town halls. And what I'm hearing is from those who are in clinics, and they have improved considerably. Some of them have doubled their number of employees over the last 8 years because of the support for healthcare clinics in the ACA, and also because their uncompensated care, that is the number of people they were serving who couldn't pay their bills, has dropped enormously. And so not only have they been able to deploy a lot more people providing health care in the community, but they've been able to do additional things. They've been able to provide more preventive services, more mental health services, and so forth. And so it's been a big win for rural America, and my colleagues want to tear that down. And that just doesn't make any sense at all. And it's why everyone here should vote unanimously to oppose getting on to a mystery health care bill tomorrow. There's so much we could do together if we want to improve health care. Fix those CSRs. Provide to fix the reinsurance. Proceed to have a full enrollment period rather than cutting it short. Retain and reinforce the individual mandate so that those who have insurance are covered throughout the spectrum, from the young and healthy to those who are older. Provide the sort of advertising that enables people to sign up and make the sign-up process a lot easier than it is right now. There's so much we could do together to make our healthcare system work better. My colleagues have come to the floor tonight to say this really matters. Quit playing games with people's lives. Quit trying to destroy the foundation for our families to thrive. And vote no on a motion to proceed to a mystery health care bill tomorrow. Thank you, Mr. President. And I yield the floor.